Documentation. I said it. It's everyone's least favorite word in home health. Documentation is the one thing that can burn you out faster than any other aspect of healthcare. Now, as a healthcare professional, you can never escape it, but you can learn to reduce the time commitment involved. I'm Dr. Trevor Miner, and as a physical therapist in home health, I'm acutely aware of the burden that documentation can be. I'm going to share with you the best methods for getting your documentation completed quickly and accurately. Now let's take a look. Be sure to stick around until the end for the best tool to complete documentation that you can't find anywhere else. The first tool you should be aware of, and perhaps the most simple to implement today, is speech to text. It's built into every modern phone and tablet and is excellent for getting your thoughts down quickly and with little effort. I find that speaking a quick assessment after a visit is a good way to utilize speech to text. You can even just use a regular note application on your phone and copy it later to your electronic health record, as long as you're not including any PHI in the assessment. An example of this is, patient benefited from today's interventions targeted at addressing lower extremity strength and dynamic balance deficits to address ambulation and timed up and go goals. Patient continues to have deficits with postural instability and hip extension weakness, which require additional skilled physical therapy intervention. It is anticipated that patient will continue to progress towards goals with current plan of care. While this can be very helpful, if you struggle to speak in clear, full sentences without pausing, you may run into issues. Additionally, you'll always need to go back and review the text to make sure there's no errors. You'll also have to get used to speaking your punctuation, unless you're using the latest version of Google's speech-to-text, which does a remarkably good job. One thing that can help when you're unsure of phrasing with your documentation are some full-text examples. I've built over 192 full-text examples of documentation phrases for therapists in home health. From assessment to interventions, goals, and communications, you can use these as they are or adapt them to meet your patient needs. I'll include the link for those down below. Speaking of templates, templates are the most powerful way to speed up time with your documentation. There are several ways to implement templates, and I'll go over those now. Make sure you stick around to the end because I show you the best way to implement templates. You can use the documentation examples I previously noted and access them to copy and paste into your documentation. But you can also build templates directly into your phone or work tablet. Both Android and iOS have options to save shortcuts that can import text. I'll link below to articles describing how to set up those text shortcuts for both iOS and Android. But the way it works is by deciding on a shortcut phrase and assigning a text phrase with that shortcut. For example, if I type Therex Resp for Therex Response, I have the option to quickly insert patient benefited from Therex today with no complaints of pain. You can create these short phrases from templates I built so you can cover every aspect of documentation. Depending on what OS you're on and what keyboard is being used, there may be limitations to the length of text you can save and import this way, but it will definitely help with phrases you want to use often. The downside to this method is that you have to manually go in and adjust values to match the specific patient you're documenting on after it's in the document. This adds additional time and complexity to the documentation process, but it's still faster overall than not using templates. Now, for the best way to integrate templates and literally cut your documentation time in half is by using a tool I'm developing called DocKeys. DocKeys puts hundreds of powerful adaptive templates at your fingertips with just a few short keystrokes. Imagine having access to outcome measures with automatic interpretation without ever leaving your electronic health record. Assessments, interventions, goals, orders, and communications for every scenario in home health. You don't have to think about phrasing or worry about what should be included because it's all there and immediately modifiable based on patient presentation. Using this method has saved me well over 160 hours of documentation time in just the past 12 months. That's an entire month's worth of working hours saved by using this tool. The tool is constantly being updated and adapted based on feedback. You can find details on the tool by clicking the link below or going to dotkeys.io. Be sure to check out the templates linked below and head over to dotkeys.io to find the latest progress on that exciting tool. Thank you all for watching, and I'll talk to you again in the next one.